Welcome everyone. We're excited to have a worldwide audience joining us for today's webinar. My name is Eric Johnson. I am the Digital Marketing Analyst here at Paragon Solutions, and I will be your webinar host for today. I want to personally thank you all for joining us for this third installment in our eTMF webinar series titled Practical Considerations for eTMF Implementation. If you have not watched our previous two webinars in this series and are interested in doing so, you can find Practical Application of the TMF Reference Model and Practical Considerations for eTMF Planning on our website by visiting www.consultparagon.com/webinars. Before we get started, I would like to go over a few housekeeping details. When you initially logged in, a control panel appeared, usually on the right side of your screen. This control panel can be closed and opened at any time during the webinar by clicking the red arrow button found towards the top of the left panel. Use the Questions panel to submit questions anytime during the webinar. We will hold all questions until the end. If time does not allow us to answer any questions, we will respond to you directly. The webinar will be recorded and a link will be emailed to you within 48 hours. You will also be able to find it on our website listed here. Finally, there will be a survey at the end of the webinar that takes approximately 2 to 3 minutes to complete. If you have the time, we would appreciate your feedback so that we can continually provide value and ensure that the topics are relevant to you. Before we get started, I'd like to provide a brief introduction to Paragon Solutions and today's speakers. Paragon is a professional services firm providing a full spectrum of consulting services from advisory through solution design and implementation for tighter alignment between business and IT. We focus on building solutions that address our clients' specific needs. We are headquartered in Cranford, New Jersey and have offices throughout the U.S. and Europe. Paragon has been in business for over 30 years, building industry and domain experience in the life sciences, financial services, communications, healthcare, and insurance industries. Our first presenter is Fran Ross. Fran joined Paragon Solutions in April 2012 and is currently Associate Director in the Clinical and Regulatory Optimization Practice. Fran has deep TMF domain expertise, both from her work with a variety of life science companies and as an active member of the TMF Reference Model Steering Committee. Presenting with Fran is Michael Agard, Principal Consultant in Life Sciences. Michael has worked on an eTMF project for 3 top-tier pharmaceutical companies. Michael strives to improve document automation, quality, and process optimization to improve compliance. As a member of the DIA, Michael leads the TMF Reference Model QC group and is also a member of the OASIS eTMF Interoperability Initiative. Without further delay, I'd like to turn it over to Fran.
Great. Thank you, Eric, and welcome everybody. To give you a quick overview of the topics we're going to cover in today's presentation. We're going to dig into what we believe are some critical factors to implementing a high-value eTMF. We'll take a little time to dig into our definitions of high value. We're going to turn our attention to what inspectors expect out of eTMF implementations and touch on the key factors we believe are critical in eTMF collaboration. Spend some time going over with you the transformation in eTMF from documents to data, why we believe that that's really an important focus for eTMF implementations, and our suggestions on how that can be accomplished. And the last bucket of information is on key aspects of continual inspection readiness, the things that you need to attend to make sure that your high-value eTMF is providing you assurance of inspection readiness. So to start, I want to take you through the ways that we define the various types of eTMF system maturity, moving from the left in an archive model through active eTMF, finally to integrated, fully robust eTMF. When we say high-value eTMF, we're looking to this right side of the continuum. We want to see our life science clients deliver more than an electronic archive without trial process support. High-value eTMFs feature integrated and robust functionality from a system perspective that allows incorporation of all the required roles with appropriate security controls and aligns and integrates within your clinical landscape to support accuracy of the metadata reporting and metrics so critical to inspection readiness. From a process perspective, your robust integrated eTMFs need to deliver the behaviors that support inspection readiness from all eTMF users. And these are users who willingly incorporate the system into their daily routines because it helps support them get the most critical work done, which is accomplishing clinical trials. So here's a visual model of what we consider a high-value eTMF ecosystem. In this best practice model, the parties identified on the perimeter have appropriate access or content externalized for their role, and this access is available to these parties globally. The eTMF system would include digital signature and electronic document processing, would make available fillable forms, and would be aligned to industry standards such as the DIA TMF reference model. In this model, the alignment has also been achieved internally with your eClinical landscape. So today we're going to delve into the practical considerations as you move your organization to achieving a high-value eTMF model. And first we want to start with the end in mind. Let's take a look at recent eTMF feedback from the ultimate in eTMF customers, and those would be your health authority inspectors. So we're going to examine now some critical factors about what the inspectors expect. It's important to note that regulations for managing trial master file and electronic systems have not changed. However, there has been valuable insight that can be gleaned out of recent guidance and reflection documents from two health authorities. The first one we're listing here is the EMA GCP Inspectors Working Group, published a TMF reflection paper in 2013. The MHRA published a book called The Good Clinical Practice Guide, affectionately known as the Gray Book, and Chapter 10 of that book covers trial master file and archiving principles. That MHRA Gray Book was published in 2012. So I took all of the different guidances and summarized them into three buckets. So we're looking at the buckets for the inspector's expectations in the course of an inspection within an eTMF, expectations about general principles for eTMF systems, and then expectations for TMF total. So these are expectations for management of trial master files, regardless of whether they're paper or electronic. It's important to note that this guidance for general TMF should be considered when you're looking at implementation of a high-value eTMF system. The frequent question is, do the inspectors inspect paper or electronic? And the answer is yes, because what you see here from the EMA reflection paper is a quote, "The inspectors must have direct access to the entire TMF, which means reviewing in an inspection the TMF as used by the staff," those italics are mine, "conducting the trial." So it's important to consider the end game in mind. So let's dig into those three buckets. I'm going to start here with considerations in general TMF management. And again, for a high-value eTMF, you want to make sure that you're covering these details in your eTMF system and eTMF process. So the first category here are organizational controls. So these are controls that you would want to build into SOPs, work instructions, and other planning documentations. The first one is TMF procedures or plans that completely detail both the responsibility and the plan for lifecycle management for a TMF from creation of a TMF all the way through archive. It's expected that that would also include appropriate archive retention periods as dictated by the regulations for the countries that are applicable and controls of that archive. The guidances also call out the need for effective organization, filing strategies, and clear indices to help manage the structure of a TMF. Controlled access is a point in the guidances, so this is controlled access you want to think about both from a paper perspective and of course controlled access within an eTMF environment. And this is controlled access to all content relevant to TMF. It's expected that the investigator would maintain control of the site file and that all of the content would be readily available for inspection. Another category here drills down into the principles of content management. The guidances clearly call out the requirement for content to be legible, complete, unambiguous, and attributable. That's very applicable when one is looking at scanning situations. There's also an interesting call out for signed and dated when required. The guidances indicate that the amount of paper that is signed and dated is fairly excessive in our industry, and that the guidances are saying to only sign and date those things that are required to be compliant with GCP. There's a specific mention of appropriate version control for the trial procedural documents. Those are documents such as the investigative brochure, the protocol, or the stats analysis plan. The inspectors want to be sure they can tell which was the version being used at the time that that procedural document was dictating some of the processes for that trial. They specifically call out that all content in the TMF should be filed in a timely manner, and ensuring in a TMF environment that subject confidentiality is maintained. When you go down even further to the third category, you look at what they're considering for appropriate process controls for each individual TMF. So when outsourced, there needs to be sponsor oversight documentation, not just of the trial, but when the CRO is also managing the TMF, the expectation is that there is oversight of that oversight documentation of that trial master file. The inspectors expect consistency between the content at the sponsor and the content at the investigative site. They want to see that controls are in place for quality assessments and quality assurance of each TMF. And then finally, complete TMF location details the suitable chain of custody. The guidances clearly call out the inspector's understanding that not all the TMF is always located in one location, and they have that content. It's also an interesting applicability to eTMF systems. Not all content in the TMF needs to be in the eTMF, but you need to be able to show chain of custody to that content potentially in other systems. The most critical part of this guidance is that from the inspector's perspective, they want to be able to sit down with your TMF, whether it's electronic or paper, and fully reconstruct the trial without having to do interviews or other kinds of resource gathering or insight gathering. They want your TMF to tell the story of how that trial was produced. The next category here are considerations specific to eTMF from these guidances. So within eTMF system controls, the expectations are very much aligned to Part 11. We expect controls for system security, appropriate system training for the roles, access controls and password security, role-based user permissions, user accounts created and deleted with formal approval in a timely manner. I know that frequently for eClinical systems, we're very careful about documenting training and getting the right people into the system. The expectations from these guidances are also that there's appropriate controls of removing people from the systems when they no longer need access. Finally, very clear guidance on audit trail, the identification of time, date, user details for creation, uploading, approval, and document changes. There's expectations in these guidances about system rigor, that there's sufficient system validation and beyond validation of the initial system, solid control of changes in the system, and also regular system backup. And then the third bucket here is eTMF content. The guidances call out the inspector's desire to see consistent, formally defined metadata that rolls across the content set within the eTMF. They really appreciate if the system is revealing self-evident naming conventions. Having documents named as numbers really gets in the way of a smooth inspection and understanding what the inspectors are looking at. They want to see controls in place for scanning quality and for the creation of certifiable copies. The ability to lock documents, to prevent changes, and in fact to be able to lock the entire eTMF to prevent any changes at the end of the study and for archiving. The guidances also call out, ideally, that workflow approval is included in eTMF that is attached with digital signatures. The final category of content are considerations for eTMF inspection preparation. The first point here is duration. The guidance clearly states the eTMF inspection should not take longer than the equivalent paper inspection, and that there should be limited time for inspector training. The expectation laid out in the guidances is less than 1 hour. We understand from inspections that have taken place that it's very much appreciated if the training takes less than 20 minutes. I want to consider in inspection preparation how the inspector is going to access the system. They'd like to see arrangements for direct access to the system, means setting up a laptop and all the peripherals, that the system is adequate and that the system performance supports the inspection, and that there is a facility available to print content at the inspector request. Even inspecting in an eTMF, there still might be documentation they want to print out and take with them after the on-site inspection. Some very clear guidance on ease of use. The inspectors expect to be able to self-navigate through the eTMF, to not have a person navigate for them, but to be able to use the keyboard and mouse and get in there directly. They want to make sure that the structure of the content is self-evident and supports their ability to find documents with also supportive search functionality available for them. And finally, visibility, or more to the point, reviewability. They would love to have the facility, the on-site location, have the facility of being able to present documents at actual size. And ideally, a side-by-side comparison is possible for the inspector. That means that you'd want to make sure that there's a dual screen setup in the case of an inspection. And the inspectors are also requesting annotation abilities, much like they use stickies in a paper TMF inspection. So this, for them, facilitates the review. It's our experience that high-value eTMF implementations should not go very far into release cycle without including some conference room pilot dry runs for mock audits and inspections. There's no better way to prepare yourself for an eTMF on-site inspection than to do a dry run with clinical members and your QA group that manages inspections, and make sure that you're all prepared. Okay. So now we're going to turn our attention to focusing on the 4 success strategy topics that we believe are really critical to achieving a high-value enabled eTMF. Mike will take us through the first topic, which are critical eTMF backbone considerations for both information architecture and clinical architecture. We'll then look at the factors that impact successful document exchange to enable collaboration and speed clinical trial processes. From there, we'll review the impact of paper on eTMF and strategies to move from managing paper in an eTMF environment to managing data. Michael then delves into the key aspects of metrics, quality, accountability, and change management that are foundational for inspection readiness. So, Mike, I'll turn it over to you.
Thanks, Fran. Do you want to pass it over to me, the controls? Good. Okay, so if we look at the information architecture, and when we think about architecture, we typically think about a building, and if we see that the floors and elevators and windows are all in place, it's a good building. But if we build a building without the windows, or we can't get to the right floors with the elevator, we have a problem. So our eTMF system is a mission-critical operation. A large part of what pharma spends on their research budget is dedicated to clinical trials. And so having a good information architecture will benefit both a paper and an electronic TMF in being inspection ready. The other thing that an eTMF does is the idea of doing it better. And one of the difficulties in clinical operations is we don't necessarily know what we did the last time. And especially going back in the paper system, it's very difficult to recreate that and then learn from that so that you can apply it to the next trial. The architecture work is difficult and time-consuming, so you want to make sure that you understand what are the content, the classifications, and the metadata. And as typical within clinical trials, everything is taken within the context of it, so that context is very important. And then the other concept is that there are content stewards, and trial and senior management are aware of their accountabilities with the eTMF system. Then the next question becomes, is all this time and effort worth it? Well, you want to make sure that your TMF is accurate, robust, and inspection ready. You also want to make sure that there is oversight and structure to your partners and how you're working with other parties that come into play. And this is one area that is of particular noted citations that there's lack of oversight and structure in these partnerships. And then really we're all familiar with the post-study scramble, the Chinese fire drill to get everything ready for an inspector. And we don't really want to do that. We just want to close out the trial in a normal manner and then focus on getting on to the next study. So our strategies, ensuring that we can nail the content. So what is the documents that are required for inspection? And the TMF reference model can be a way to look at your records. We often find that there's a number of records that are not really needed and just create a lot of noise in the TMF. And as Fran mentioned, we want to make sure that we know where all of those documents are located, with what is the system of record, who's the owner of that particular section of information, what's the relationship of the documents in collection to milestones, and then are you compliant with your SOPs and also managing the investigator site file correctly. You can also look at setting the right level of approval for documents, and can those be self-approved or auto-approved, or do they really need formal review and approval? Which documents are expected when, and documents that are expiring. Certain documents such as contracts and legal and financial agreements need special security, so that's very important to the process. The other thing is that we want to make sure that there's an authoritative source of the truth and that we can reuse that data. With our clinical architecture, we want to look at beginning this whole process with what's the end in mind. So ultimately, we want to write a clinical study report. We want to have a good regulatory submission. We want to have information that supports marketing claims. And we need to look at the whole process of the systems and how they align, how they contribute to the information. We really want to identify one source of that truth and then reuse that information. We're seeing a lot of increase in data hubs and data warehouses that allow this process to happen. And as we know that the critical success factor is that nothing in clinical operations happens in a vacuum, and everything is related. So we want to really drive the trial management process to using our eTMF system. And increasingly, there's a drive towards more efficiency in trial management, either by outsourcing. We also see both an increase in service level agreements for internal and external processing. And then making sure that there's consistency across studies. I know this is a big impact with regional areas and differences. identifying the source of the system of record, data of record, and then push and pull data as required. And one of the big benefits of an eTMF is being a process driver, that knowing that the site documents are complete and you can ship the drug. Being able to share safety information, safety letters through the system, and also event-driven activities such as protocol amendments. We want the users to become content stewards instead of content dumpers, and try to minimize the email and so forth that is the noise that gets into the eTMF system. And of course, we want to enable seamless technology with our CROs and partners. So as we get into collaboration, and Fran showed us the collaboration model at the beginning, we want to make sure that we can provide access and security for the right people at the right time, making sure that they can exchange the documents that they want to or need to work on in a timely manner, and then also decreasing the complexity of document approvals. So as you assess your security and access model, you want to look at who is getting access to the content, so which organizations, which CROs, what roles, what credentials do they need to ensure that who is getting the content is the right person. You also want to decide what content that they have access to, so which trials or which zones and sections of the document, and then even which documents do they need to access. And then certain parameters such as the trial, country, and site status, or the status on a particular artifact may limit as to who can access that particular document at that time. We see that there are several methods of document exchange options, so creating from templates and uploading documents, batch uploading. Also several ways to download content to our collaborators. So often it's email and then downloading content. So I want to make sure that we're looking at the most efficient and cost-effective way to manage this content and process. As we look at document approvals, we see that digital signatures have not increased significantly, largely because of technology, cost, and training constraints. We see that eTMF is enabling electronic workflows and also task completion, which is promoting a decrease in wetting signatures and the acknowledgement of reading information. And now we'll turn it over to Fran to manage data and documents.
Thanks, Mike. So when we look at a high-value eTMF, we know that one of the considerations that we like to see the life science organizations take is how to make sure there's maximum value coming out of the eTMF systems. One of the things that we believe needs to be brought to the forefront is reducing to the maximum possible the amount of paper that's being delivered into the eTMF system. So here's some of the factors of why it's important for organizations to consider getting the paper out of eTMF. Firstly, it drives the content availability timelines, right? So your eTMF system is online and ready, but if you're generating paper, moving paper around, and then scanning, indexing, and quality checking paper, it can delay that content availability for days or even weeks till it's available for folks who need to use that content. And if you remember back to the inspection considerations, timely filing is a point that the health authorities make in those TMF guidance documents. So scanning automatically introduces a delay into eTMF content availability. Scanning also adds significant complexity to content processing. Scanning requires expert handling to ensure the image quality and adds additional level of quality control to eTMF for certified copy creation. So before you can even apply your quality controls to make sure that the content is in the right place and that the documentation is saying the right thing, there's an additional QC step just to make sure that the image matches the paper. Scans must then be accurately indexed and brought into the system into the right place for retrievability and for appropriate structure. And whether your scanning is centralized or localized, there's management of the paper, right, and costs of moving the paper from point A to B, point A to B to C, point A to B to C to D. We see a lot of paper movement brought into the picture when you look at moving paper from clinical sites to hubs to sponsor, clinical sites to hub to sponsor the CRO. It can be quite complex and unnecessary if the content is being generated electronically. At the end of the day, there's paper to manage then for archive or destruction. So the defensible paper destruction process is quite a significant undertaking. There is an excellent resource in a position paper that's been put out by the TMF reference model on paper destruction that details all of the organizational aspects that have to be considered if you're setting up a defensible paper destruction policy. It includes departments like legal, quality, records management, and IT, as well as your clinical and other business processors. Paper destruction is not an issue if you create the content and manage the content electronically. And finally, having paper scanning and having a centralized group that's responsible for document upload to the eTMF makes the content responsibilities remote from the content creators. This adds a layer of middle management for content processing, and it decreases the sense of quality responsibilities from the folks who create the content in the first place. The document processing group developed quite a significant expertise, and how much more effective can that organization be if they apply that expertise to inspection readiness, to quality metrics assessment, and to eTMF process improvements. So here's some key factors we think are really important to consider if you're looking at a paper reduction process for your eTMF. The first key is index simplification, removing from your expected content list the content that mandates ink signatures. Too frequently, insufficient attention is given to the business process documentation that has outlived its usefulness in the era of high-value eTMF. We still see myriad requirements for ink signatures that are mandated in SOPs that put the businesses through paces way more than GCP requires, much more than the inspectors expect. But since it is mandated in the client's SOPs, it has to be adhered to. So for example, a sign-off of an investigator brochure site distribution creates needless paper churn. Paper forms to document the development and approval of your ICF templates can be replaced by reliance on eTMF workflow and audit trails. So going back to your index and rigorously weeding out trackers and signed processes that don't need to be confirmed by GCP can result in myriad benefits and is very key to paper reduction. This also means reworking your SOPs, and it is quite an arduous process, but once it's done, you can see real value from this effort right away. So we strongly recommend that you optimize your index. Hand in hand is ensuring that eTMF responsibilities lie in the hands of the content owners and creators. When electronic from the start, many metadata properties for the content in eTMF can be automatically incorporated, reducing the problem of keying in or inaccurate entry for metadata. Ensuring the content source has content responsibilities also increases their understanding of their requirements for quality control. Since they're not handing off the paper for a document management team to curate, QC, and process, the content stewards start to understand how critical it is for them to get it in the right way with the right stuff the first time. Of course, your system and workflow must enable electronic approval processing. Both your eTMF technologies and the processes around those technologies have to be validated to Part 11 control requirements if you're using electronic signature. As Michael discussed, the flow of authoritative source data into the eTMF system is especially supportive of the move away from paper. Many TMF documents reuse data already existent in your eClinical landscape and in other TMF documents, and why recreate those wheels? You can decrease repetitive keystrokes and error rates and let the data do the work for you. Your eTMF system and your document creation processes and quality system processes must all align to enable the use of fillable forms and smart docs. Robust eTMF systems support this usage, but your processes also have to be in line with being able to let your team create content in this manner. The bottom line really for paper reduction is establishing really solid foundations for both the eTMF information architecture and within the broader eClinical architecture landscapes. When it's successful, moving from paper to data supports speed and trial accomplishment and reduce cost and complexity. It can also free your most valuable organizational assets, your eTMF experts, to focus on what's required by the ultimate eTMF customer, and those are your health authority inspectors. Mike's going to take us back here to delve into more of the factors to ensure inspection readiness.
Okay, Fran. So, favorite aspect, of the eTMF is the required document tracking and aligning up those artifacts to when they're expected. And so this gives us a much more proactive management of the eTMF, so we can know that what's been passed and what's completed and is accurate and complete. We know that there's a decreasing list of documents that we expect in the near future. And then looking at the long term, what are the expected documents at the next milestone, and then proactively managing those documents. So we also want to continually look at the completeness, accuracy, and timeliness of the documents. These are some of the factors that came out of the DIA TMF QC metrics group, and I think these are general enough but robust enough metrics that they can cover the different areas. And so we want to kind of have a stepwise progression from the individual document review, functional section review, structured periodic reviews, and then finally ending up with the audit and inspection. But it shouldn't be that you're concerned about that, because you've built the process along and built the quality in by design as you go through the process. So if we look at the trend analysis here, we can see that, as I mentioned earlier, that service level agreements are becoming more and more the norm. Really looking at our SOP compliance, trying to minimize the regional variations and individual variations and trial type variations. It seems like each study team or each therapeutic area tends to do things a little bit differently, or each country, and a robust eTMF can help to remove those variations. And it can also make it consistent trial to trial. One of the red flags that's been mentioned recently is adding a number of documents at a particular milestone or just prior to inspection. So this points a red flag back to your SOPs that you're not really following your SOPs and real-time management of the study. Some other areas, especially introduced by the change to the TMF index, is that the documents are not correctly indexed, and always the content is some questions about the content and the accuracy of it, and largely the CRO oversight and being as close to real time as possible there. The eTMF process is a continuous improvement process through and through, and you can't just go through this cycle once. You have to go through it many times and continue that process. And it starts with communicating the plans, the training, the time, what's been changed, then developing up your training plan, examining what areas need to be retrained, assess the performance of the training. Are people doing what is expected of them? And then this goes back into change management to see what can be improved upon continuously, and then revising the SOPs, work instructions, and training, and then repeating that cycle to communicate what the next level of quality initiatives are for continuous improvement. And back where we started is this best practice for clinical trial collaboration model. And we know that everybody has a seat around the table for their specific roles and documents and the timeliness of doing that. And the more that we can expand out to these peripheral partners and actors in the trial, the more robust our eTMF system is going to be. And right now, I'll turn it back over to Fran, and some of the questions. As a reminder, there is a question box on the right panel, so we'd ask you to put your questions in there. I know there's a couple questions in there already, and we'll go through that. So, Fran?
Terrific. Thanks, Mike. So the first question is about feedback from the FDA, and I was anticipating hearing this because we haven't heard much from the FDA about TMF. So what does the FDA say about eTMF? They say that they're very supportive of eClinical tools, and they really welcome dialogue from the industry on the best practices and pathways to use all eClinical tools. They state over and over that the regs that govern behavior are in the CFR, and Part 11 is critical to using all the eClinical tools. If you're attending the DIA annual meeting, I highly recommend going to the Ask the Regulator sessions. I attended one last year where the eClinical FDA related experts were on a panel, and unfortunately it was the first thing in the morning and there were only about 12 people in the audience, but they were there to have an open dialogue. They want to have that back and forth. They want to understand where the industry considers things to be complex in FDA regulations and support moving trials along quickly to high quality. So the only regulations that, the only guidances that you can rely on when considering eTMF from an FDA perspective is to look at the Bible for the inspectors that's freely available online. That's the BIMO, B-I-M-O, Compliance Program Guidance Manual. From an FDA inspection perspective, they don't look for the TMF. They look for key trial content that's laid out in this guidance manual. And this key trial content we'd recommend would be considered as part of an eTMF high-risk pool and part of the content that you'd want to pay particular attention to when you're developing your risk strategies and your metrics for TMF quality and eTMF inspection readiness. So there's another question here about what's meant by providing, let's see, key points you would consider when providing oversight to a CRO. I'm sure Mike has some things he wants to add here. I would just say that you want to make sure your CRO engagement model is successful from the start. When you're looking at eTMF behaviors with a CRO, you want to go back to the contract and make sure that the contract reflects the ways that you plan on having the CRO and eTMF interact. And it's actually true that you'd want to go back to the contract whether the CRO is working inside your eTMF system, or continuing to provide paper to your people who will be getting that into eTMF. There's all sorts of different models for interacting with your CRO, but one of the first key considerations is making sure those models are permitted within the contracting environment, and then you need to plan to set up the trial the right way and make sure the roles and responsibilities are clear for what's going to come when you're giving the CRO tasks as far as TMF is concerned. Mike, do you want to add to those considerations?
Yeah, I think that one of the key documents that we're seeing in this area that's sort of been neglected in the past is the trial master file plan, and what documents are managed by the CRO, what's the timing, what's the service level, getting them into the system or back to the sponsor, and the full life cycle of that. I think also the tools that enable near real-time collaboration are important. And then I think also that there's, your SOP and training for your staff to show that they are complying with that oversight model that's set up. And one of the key tug-of-war things is whose system are you using? Are you using the CRO system? Are you using the sponsor system? Are you using both? And those things that align to a strategic partnership really should be thought out at a much higher level before you even begin at the trial level. Okay, Craig?
So a question here on recommendations to convince the SOP owners to reduce and remove signature requirements. That's such a great question. One of the things that's critical is to make sure that the folks at that expertise level understand how the eTMF can help you be compliant. So it's really bringing quality, those SOP owners and IT to the table to first make sure that everybody understands how the eTMF system supports compliance with Part 11 and enables you to reduce the signature. And then it is generally, we'd recommend a test situation where those folks are working in a sandbox environment along with a team who's doing a proof of concept of how the approval flow would work, as well as a circulated piece of paper, and in a lot of cases works even better than a circulated piece of paper. Right now there's stories of scrambles at the end of the day when you've got a sign-off sheet for an ICF template that's been signed by 9 people and you can only find 8 of the pieces of paper, and that 9th signature is floating off somewhere. When people see how embedding that process in the eTMF can smooth the process and help increase compliance and increase inspection readiness, again, it's generally important to show them that proof, and then it can really smooth the pathway to making those SOP changes that are required to be able to use the technology in that fashion. So here's a question. Have you found sponsors to consider implementing an eTMF to be higher priority than implementing a CTMS? Mike, let me let you take a run at that.
I think they really go hand in hand, and I think that there's some of the newer eTMF systems can enable management of some of the data that was formerly managed by CTMS. But really, they need to go hand in hand, and as we talked about, the CTMS is really upstream and drives, it's sort of like the brains of controlling what needs to be done in the eTMF and then documenting that in the eTMF. But certainly close collaboration, planning out the data interface and the exchange and timing and the quality of the data is very, very important. And I think overall we want to get away from the spreadsheet management of the clinical trials and make it a more repeatable and robust process.
Yeah, I think for many sponsor organizations, it's generally considered more helpful for the organization to make sure their CTMS is enabled before the eTMF is enabled, because the CTMS, from an executive management perspective, often gives insight into study data that they want to be able to see quickly and on a regular basis. It's important to flip the coin with those folks and show how eTMF can really support inspection readiness and how eTMF can take the kinks out of paper document processing. The costs associated with not having a robust eTMF system is usually can very highly motivate organizational sponsors to get behind an eTMF. We would always recommend, when looking at an eTMF system, that you strongly consider the data points, as Mike went over before, that are available in your CTMS, and not duplicate that data, but make your system data be able to share authoritative source data for trial protocol ID and country identification and site identification, etc. Mike, can you talk a little bit about the most challenging aspects of TMF continuous improvement?
Sure, Fran. For continuous improvement, we're seeing that there's resistance to change, that people want to do things their old way. They're reluctant to invest the time, or don't necessarily have the time to take the training and understand things. And one of the challenges with reduced budgets has been the approach to training, and less hands-on and less face-to-face in more e-learning types of modules. And it doesn't necessarily get the message across, and so, or people aren't reading that they need to do something, and so it's just the factor that people are really busy, and also the number of parties that are involved in the clinical trial process now, making sure that they're all on the same page with the expectations of how the system needs to work and function. And this points back to having a strong governance over your eTMF and related systems, and then also making sure that the service level agreements are being followed there.
There's such a lot of great questions in the question panel, and we've committed to getting back to everyone who's asked a question today. So if you have an additional question, please don't hesitate to put it in the panel, and we'll make sure we get back to you on that. To wrap up today's session, there's one last great question about getting sites on board with moving to electronic documentation, enabling a pure eTMF model. And we see in our experience that sites are a customer of eTMF that can be forgotten in the amount of work it takes for a sponsor to get a high-value eTMF up on board, but it's critical to consider the site perspective. What we've heard feedback from sites is that they don't want to have happen to them with eTMF, like what happened to them with the early days of EDC. They felt in the early days of EDC that they were expected to take on a data management role, and in these days of eTMF, they don't want to take on a sponsor document management role. With getting site content smoothly into eTMF requires looking at what's in it for me from the site perspective. If you can help the site smooth the pains of document processing, if you can help the site come into a system where they don't have to manage 27 logins and passwords and go through too many hoops to electronically sign documents, they're happy to do it. But it's that hoop consideration, it's adding extra work onto their process. With eTMF, the system moves great improvements in this area over 2014, 2015. So Eric, we'll turn it back over to you. I think that's all the time we've got for questions today.
Great. Thank you, Fran and Michael. That concludes our webinar for today. We hope you were able to take some valuable and practical information to support your eTMF implementation. If you have additional questions, feel free to reach out to Fran and Michael. Their email addresses are listed above on the screen. Again, thank you for joining us. We understand your time is valuable and appreciate the time you took to be with us today. If you have a few minutes, we'd appreciate your feedback on this webinar and your thoughts on the direction for future topics in the survey that will be sent out after the webinar. As a quick reminder, a recording of this webinar will also be sent out to you via email and will be available on our website. Thanks again, everybody. Have a great day.